Right, hi everyone. I'm Liz Goodwin and I'm from the University of Exeter, and I'm a health economist, or as somebody referred to me as yesterday, cost benefit woman, which has got to be the most rubbish superhero ever. A health economist is basically someone who applies economic principles and methods to the study of health and healthcare. And what's probably of most relevance for today is one of the things we do is provide evidence about the value and value for money of healthcare interventions. And recently, my colleague Annie Hawton and I have been applying some of these techniques to heritage-based interventions. So today we're going to be talking to you about some work that Annie and I are doing or have done with Shannon here, who is from the National Trust, and also with Vanessa Heaslip from the University of Salford. So I'm going to be using the term heritage-based interventions today, so I thought I should probably provide a definition, which I've done on the slide there. And as the images on the slide suggest, there's quite a range of different types of heritage activities that can contribute to people's well-being. And I also think that there's a bit of a spectrum here. So at one extreme, you've got interventions that are designed explicitly to improve people's health and well-being, and they use heritage as a means of doing that. So with those, the focus is on intervention. And then at the other extreme, you've got the kind of heritage-based activities that people just do as a hobby, a personal interest. So there, the focus is very much on the heritage. So these are not things that are designed at all as interventions, but they do still have a positive effect on people's well-being and on their health. And I'm going to be giving examples from kind of opposite ends of that spectrum today. Now, I would imagine that everybody in this room believes, or dare I say knows, that engaging in heritage is good for people's health and well-being. But so far, quite a lot of heritage and wellbeing projects have been time limited and relatively small scale. So what I'm interested in is, how do we step this up? How do we make sure that more people have the opportunity to benefit from these kind of interventions? Who do we need to convince of these benefits? And what evidence do we need to persuade them? So one very obvious option is to go through social prescribing. Social prescribing, of course, is an NHS initiative. So the people that we need to persuade are NHS decision makers. And NHS decision makers do expect quite specific types of evidence. They expect to see clinical trials and economic evaluations to show the value and the value for money of interventions. And work has already started on applying these kind of methods within a heritage context. So Corenza Lewis and Joe so far, among others. And today I'm going to be talking to you about some of the work that we've been doing in this area. But before that, I'm just going to run through some basics, because even if we're not going to go down the route of kind of full clinical trials for heritage-based interventions, it is worth understanding what the key components are, and how perhaps we might adapt these to kind of fit with the heritage context. So, what is a clinical trial? A clinical trial is used to show whether a new treatment works better than the usual treatment that people currently receive. So it compares the effects of the new treatment with the effects of the kind of existing usual treatment. And we do this by recruiting a number of participants, so that's people with the health condition that the new treatment aims to treat, and we split them randomly into two groups. We measure the health of the people in each group at the start, and then one group gets the new treatment, while the other group, the control group, gets the usual treatment. Then, after they've received their treatment, we measure the health of people in each of the groups to see how much their health has improved. And if the group who gets the new treatment has a bigger improvement in their health than the group who got the current treatment, then that shows that the new treatment is better. With an economic evaluation, you need to collect some more information during the trial and do some extra analysis. So with an economic evaluation, at the start of the trial, we measure what healthcare services people have used in the few weeks prior to starting the trial. And we also measure their health using a slightly different method to what you need for the trial itself. We also measure how much it costs to provide the new treatment and how much it costs to provide the usual treatment. And then at the end, we measure what other healthcare services people in each group used during the trial. And so this is something that's been mentioned in a couple of the earlier presentations. The idea being that if a new treatment works really well, it might mean that people don't need as many GP appointments or hospital visits or drugs or whatever it might be. And then analysing all of this data enables us to work out if the new treatment is good value for money compared to the existing treatment. So what happens if we replace the medical intervention with a social prescribing intervention that's based on heritage? Well, I think there are likely to be some challenges. And that's largely because the methods that are used in clinical trials are designed specifically for kind of standard healthcare stuff. So drugs, surgical procedures, that kind of thing. And the ways in which heritage-based interventions are run and provided are very different. Plus, they're not exactly healthcare interventions, so we might want to measure slightly different or additional things. So we might be interested in the impact on people's general well-being rather than just very specifically on their health. And we might be interested in a wider range of different kinds of service rather than just healthcare services. So that was the background. What I'd like to do now is just focus on a couple of specific projects, one past and one current, and then open things up a little bit to think a bit about the future. I'm going to start with the Scaling Up Human Henge project, which we worked on with Vanessa Heaslip and a range of partners. I'm going to read these out. So this was Bournemouth University, the Restoration Trust, Avon and Wiltshire NHS Mental Health Trust, English Heritage, Rethink Mental Illness, the Richmond Fellowship and Wiltshire Museum. So the main research question for Scaling Up Human Henge is how best can we deliver viable and sustainable place-based cultural heritage therapy programs using archaeological sites and ancient landscapes to benefit the health of whole communities. And a key objective of this study was to evaluate the therapy program. And so that's where Annie and I came in. So this was a very actively therapeutic intervention. It aimed to harness the power of place, and it used group activities involving archaeology, music, dance, and craft-based activities. The group met once a week for 10 weeks, and it was a group of 18 people with quite serious long-term mental health conditions, and there was no control group for this study. For the evaluation, the idea was to collect the kind of data that we normally would for an economic evaluation. So we asked people what health services they used, plus any social care or voluntary sector support. We asked them about their health, specifically their health-related quality of life, and we used the measure that is like the standard measure for economic evaluations called the EQ5D. As well as that, we asked them about their mental well-being using the SWEM Webs, the Warwick Edinburgh Wellbeing measure that others have used. And we collected this data before, during, and immediately after the programme, and then again 6 months later. And we did all of this alongside a qualitative investigation that was led by Vanessa. And we got two different types of output from this. So one thing was to get the actual results of the study. So what were the effects on people's health and well-being and resource use? And the other was for us to learn about collecting economic evaluation data in the context of a heritage-based intervention. So in terms of the results, with service use, receiving the Human Henge programme didn't really affect the type or the amount of services that people used over that 6 months period. So this might be indicative of the significant mental health support needs of this group. And also it could be related to the fact that Human Henge isn't really a healthcare intervention itself. So maybe we wouldn't expect it to kind of replace the healthcare that people receive. In terms of people's health and well-being, at the start of the programme, people's health-related quality of life was strikingly poor. But both their health-related quality of life and their well-being had meaningfully improved. You can see on the graph here, the third one along is the end of the programme, and you can see that both health-related quality of life and well-being had improved by the end of the programme. However, if you look at the fourth columns there, after 6 months, people's well-being and health-related quality of life had dropped a bit. So I'll say a bit more about that in a minute. And there's an important caveat here. We do need to be careful about reading too much into these results because it was a very small sample and there was no control group. So what did we learn about collecting the economic evaluation data in this context? I suppose the main thing is, yay, it is possible to collect this data in a heritage context. There's a point I think comes up around sort of funding and support infrastructure. I mean, for this evaluation, we were a bit limited in what we could do. Usually in health research, I mean, there's like a massive national and local infrastructures around health research, specifically around sort of trials and economic evaluations, but more generally as well. So if we want to do this kind of research in a heritage context, we're either going to have to tap in to those existing funding and support structures, or we're going to need to develop our own. And we also felt that there's room for some longer term research here as well in a number of areas, but specifically, we really want to understand more about that reduction in health and well-being after 6 months. What happens after that point? Does it stabilise at that level? Does it continue to drop? And would a kind of maintenance dose of the intervention help to generate more kind of sustained improvements over time? So that's that one. The project is finished. We're currently writing it up, and we will be submitting it for publication in a peer-reviewed journal at some point soon. And Dickie, we will be in touch because we'd love it to go into your review. I'm going to move on now to some stuff that we're doing currently. I mean, very currently. This project started just this month. This is one that Annie and I are working on with the National Trust, specifically with Shannon and also with Tom Dommett. And so before I get stuck into this project, I'm going to hand over to Shannon to talk a bit about the National Trust and wellbeing in general.
Thank you. Excuse me. So National Trust is a bit of a random 2-minute interjection because it's mostly Liz that you're here to hear from. We like pretty pictures of people enjoying themselves and looking very happy. That's often what you see with the National Trust. But why am I here? So I'm the National Archaeologist, which sounds like a very grand title. It really just means that I support anything around engagement with archaeology / historic environment / heritage, which unfortunately we use slightly interchangeably in the National Trust. But my background is very much a field archaeologist from East Anglia. The wellbeing area and evaluation, I sort of fell into it partly through this working group that you've heard us all reference many, many times, and partly because I was given the remit when I started in this post a few years ago to evaluate the benefits of participating in archaeology. Then I went into this working group, and I must admit I panicked massively because you think that sounds quite simple, right? We evaluate the benefits of archaeology work, but then you start thinking we're talking about historic environment as well. We're talking about all things heritage, and actually this group opened my eyes to the fact that it is much bigger. And as Dickie said, it's not just well-being, but actually heritage evaluation, heritage generally is quite a big thing to tackle. So I thought about what we're going to evaluate, what and how. And then I thought, well, we'll evaluate what we do. And I thought, what do we do in the trust, actually? And I panicked. I thought, we're behind the sector, actually. We're behind. We haven't thought about this sort of consistent approach with how we evaluate things that we're doing. But I realized that's not actually true. We do stuff in the National Trust. We do stuff everywhere. We do it all the time. I've seen oak leaves in people's various presentations. A lot of the projects that people have referenced here, they've been partly on National Trust land as well. We are involved. We've got work going on with Exeter, UCL, Southampton, CBA, and others. We are doing stuff. The Heritage Open Days team, who some of you might have heard from this morning, they're very much starting to lead that way in sort of heritage and evaluation for an aspect of the National Trust. So we are doing things, but the caveat is that the National Trusts tend to focus on articulating those benefits associated with nature engagement. They've started to move into that sort of curated space into our sort of houses and our sort of, our grand houses and buildings. But what about that intangible or that less tangible cultural heritage and the impacts on well-being that those outdoor cultural heritage landscapes might have on people? So the challenge for us is huge because we've got around 500-ish properties, 250,000 hectares of land, each with their own property team, each delivering their own initiatives, each doing their own thing, working with different communities, different people, different aspects of well-being, different populations. It's a very, very complex thing. So how can we think about a consistent approach to understanding and measuring the well-being impacts from heritage specifically, and heritage at our places, our diverse range of places? And as Dickie said about well-being being so broad, and talking to the HODS team, heritage is broad as well. And these are two massive concepts that we're trying to pull some sort of national consistency towards. So I feel relieved in the fact that I've not achieved that yet. I haven't come up with a framework in the National Trust, and that's okay, because as a sector, we haven't got a framework for it. So that's okay. So for me, I think the answer for the National Trust right now is partnerships, and it's research. And this is the area that I'm really, really excited about, because I think we've got two things that we can look at in the National Trust. We can understand those day-to-day benefits of people experiencing our sites and our landscapes, and we can try and pull out that specific connection between the cultural heritage and well-being in landscapes that are often perceived as natural. So we can start to move away from just looking at the well-being effects of nature engagement and start to look at the sort of cultural heritage aspects of the well-being impacts. And the other thing that we can do is we can offer spaces and places to test and to research heritage-based interventions as well. So we can generate that evidence, we can generate those learnings for the sector, but also that can help our individual properties drive and deliver well-being through heritage engagement and all the different types. So I'm really excited that I think we're at this really pivotal point in the heritage sector about driving research in different directions. And I'm really excited that I get to work with lots of different people in different areas of well-being research. And specifically the project that we're doing today, which is looking, I never would have dreamed that I'd be working with health economics, but obviously I'm moving into this direction temporarily, and another day I'll be in a different direction. So I'll hand back to Liz to talk about the project that we're doing.
Thanks, Shannon. Right, so the project that we're doing is called Conserving the Mind. And the research question here is, does conservation in action produce a measurable impact on the mental well-being of visitors? So conservation in action, I'm hoping I'm summing this up correctly. It provides opportunities for visitors to observe conservation work at various National Trust places, and they can speak to the team who's doing it and find out about what they're doing and why. That make sense? Good, thank you. The reasons why we're doing this, we want to try and develop an approach for generating evidence for well-being impacts right at the point of engagement. We want to produce evidence to inform National Trust planning for future activities. And also this is seed funding. So the big idea here is that this is an initial step, hopefully, to developing future research funding applications. We're currently in discussion with 5 National Trust properties that will be running conservation in action activities. So these are activities that would have been happening anyway. So this is not an intentionally therapeutic intervention. We'll have a larger sample than we had for scaling up Human Heritage. So we're aiming for around about 300 participants overall. And they will be members of the general population rather than people with a particular health condition. And this will be adults rather than children, but this photograph was too good to not use. We will have a control group this time around. These will be people who are visiting the same places but not participating in conservation in action. But we'll be looking at the immediate effects only. So we're going to ask people to complete a wellbeing questionnaire immediately before and after their visit, but we're not going to be following them up longer term. And we're only looking at well-being. We're not looking at health-related quality of life or service use. And similarly to scaling up Human Heritage, there are 2 sort of things that we're hoping to learn out of this. One is we will obviously analyse the wellbeing data that we get, see if there's a meaningful change in wellbeing from before compared to after the visits, and whether that's different between the visitors who have and have not engaged with conservation in action. And then there's what we expect to learn. This is the bit I'm calling the feasibility analysis. So is this something that we can practically do? So there's some statsy kind of stuff that we'll do there. So we'll look at things like response rates and missing data and statistical distributions of responses and things. But also it'll be really useful to get feedback from the sites on what it was like to actually get the data. So looking to the future. So far we've applied kind of bits of the methodological framework for trials and economic evaluations, as have others as well. So where do we go from here? It seems to me that there are two options, and there are certainly two views that have been expressed over the couple of days here. And these two options are not mutually exclusive. So one is we put all of those pieces together and we go for it, and we do a full RCT, randomised controlled trial of a heritage-based intervention. And we are taking this forward, hopefully, because we've got a current funding application in that's led by Carenza Lewis. It's called HeriPart. So fingers crossed we get the funding for that. The second option is to take this methodological framework and adapt it into something that is practical and achievable within the heritage context, that will be generalizable across different contexts within heritage, because I know that was a concern expressed last night about whether clinical trials tend to be a bit too narrow in their focus and lack that sort of generalizability. I think that is something that we can address. And finally, it will have to be capable of producing the evidence that we need in order to convince the key decision makers. And so really, this is why I'm here, is to have those discussions about where we go from here and what role health economics can play in building the evidence base for heritage and wellbeing. Thank you.